So first, let's classify what do we mean by drugs. So drugs are some kind of substance, some kind of chemical that's used to produce physiological or psychological effects in humans. So physiological means it affects the human body, maybe heart rate, maybe blood pressure. It affects something about the physical body. It changes, it removes pain. And psychological effects, of course, are how we feel, our euphoria or a calmness. So those kinds of effects, any chemical that would produce those kinds of effects would be classified as a drug. Now, not all drugs are illegal. And of course, one of the things that we are looking for in terms of the nature of the drug experience is psychological dependence and physical dependence. So what is the likelihood that people would feel compelled to take it again and again, either because of a psychological effect or a physical effect? So one of the things that we look for when we're talking about repeated drug use, which eventually becomes drug abuse, would be either a psychological dependence for the continued use of the drug, or sometimes we also will talk about physical dependence. And of course, when we take drugs, there is an emotional factor for it. So, and there's a very different experience by different people, your personality, your expectations, your peer group, and how you take this. All of these things play into the psychological dependence and the psychological factor of taking drugs. Of course, some drugs will have a continued use to, expecting a very high level of involvement, and others have a lower potential for abuse. So not all drugs are going to be, some drugs are very easy to become addicted to psychologically or physically, and others are less likely. And we know that from alcohol consumption is a legal drug, that we have a lot of evidence and to support what happens. We know that you can't generalize when it comes to drug abuse. Some people can have a very small amount of alcohol and become quickly dependent, and others can drink very large quantities and not become dependent. Physical dependence is a physiological need. Something happens in the body that you actually have physiological response if you don't continue to use it. So withdrawal sickness, delirium tremors, some kind of physical response by the body. Marijuana and cocaine are examples that don't lead to a physical dependence, whereas alcohol, methamphetamine, and heroin are examples of drugs that have a strong physical dependence. All of these, when people try to quit, have physical responses to trying to withdraw.